I'm Alpha, and this is my 5-minute morning show. Gonna start the clock right now. Here we go. Well, the dust is settling a little bit from the health care bill. It is signed. It is now law. Whether or not the fix-it bill will pass or whether there's going to be any tweaks in it, it's yet to be decided. But we'll get back into that in just a bit. Now the more important things in the world. First, a little brain teaser for you. Radio City Music Hall employees handle 600 pounds of this every month. What is it? The answer will be at the end of this 5-minute show. And more important things like Dancing with the Stars. You watch the show, it's kind of mesmerizing in its own way. Pam Anderson, yeah, I wonder why they picked her for the show, although she is quite a good dancer, along with her other assets. Kate Goslin of John and Kate Plus 8. I understand she's been quite the diva. And then Buzz Aldrin, poor guy. Quite an astronaut, you know. I mean, as astronauts go, he should stay an astronaut and quit the dancing. But the guy, you know, he's almost 80 years old, I guess. And he wasn't very good, but how can you really kick a guy like that off the show? I mean, come on. What kind of country is this that would do that to one of our American astronauts, huh? The most powerful woman in the world, that's what she's being called now for passing this health care bill. Nancy Pelosi, the most powerful woman in the last 100 years, they're saying. And you gotta hand it to her. I mean, she did twist arms and grab noses and buttonhole people and call in favors and threats and whatever else she had to do to get this health care bill passed. But it is now passed, and she's being called one of the most powerful women in 100 years. It's hard to argue with, I suppose. She's not very popular, though. CBS News poll had her approval rating, or at least people who thought favorably of her, at 11%. 37% thought unfavorably. The rest either didn't know, were undecided, or hadn't heard enough to know. What do you mean? Aren't they all the same thing? I mean, they seem like they should add a couple of other categories, like I'm too big an idiot to have an opinion, or I'm too concerned with what's going on with the situation on Jersey Shore. You should have some sort of opinion, shouldn't you, unless you're just a total moron? All right, back to the health care bill. Here's the kind of thing that's going to be happening now, and correct me if I'm wrong, but this is not going to be a situation where doctors just throw their doors open and everybody gets to come in and be treated. I mean, this is not like the medicine man at the reservation. It's not like the witch doctor. I mean, you got to come in, you're going to have insurance, because that's what the bill says. You have to have insurance. And you either get it from your employer, buy it yourself, get it from the government, we assume, or the IRS is going to come after you. But you got people like this who really don't understand. This guy, I'm going to have to read some of this here. His name is DeCarlo Flythe in Durham, North Carolina. And he says, it's going to be like Christmas now. You can go to the doctor and pay your copay and not have to worry about bills. Is that the way this thing works? I really don't think so. The guy, I feel for him. He's a diabetic. He's checked into buying a policy for his family, but he couldn't afford it. And he's got a new job, but those benefits haven't kicked in yet, and he worries day to day, prays nothing happens, and I can relate to that. I can understand that feeling. But he's among the patients at the Walltown Clinic, a joint program of Duke University and the Lincoln Community Health Center that serves low-income neighbors at Duke's campus. They serve 3,000 to 4,000 people a year, and 80% of them don't have health insurance. So what you're saying is these people do have access to health care. And they come in, they get treated, they pay whatever copay they can afford. In other words, if they can afford $20 that week, they give you $20. If they can afford $5, they give you $5. If they can afford nothing, they pay nothing. So they do have access to health care, right? And this health care they're going to get, not going to be better than this, because you got to pay for it. I mean, you have to pay for it yourself or get fined by the IRS. They'll come hunt you down. Then there's this guy, Norman Rucker, hadn't had health insurance in almost 10 years because of employees haven't offered it. Okay. I'm not a person who gets sick a lot, he says. I don't think I need any medicine, but he's racked up a $100,000 hospital bill because he goes to the emergency room anytime he's sick. Well, it sounds like you're pretty sick to me at $10,000 a year. And they checked into getting insurance on his wife's plan, but he said it would cost too much. Well, simple math tells me that if it's costing you $10,000 a year to go to the emergency room, unless her insurance plan is going to cost you an extra $900 a month, you're saving money. But I guess they figure that's money they'll have to pay. This other, they won't, because this new health care bill is going to erase all that, right? No, don't think so. He says here, it'll make the world better. It'll make us all better, actually. I do not think that bill means what you think it means. Well, these things will be coming out. You'll be hearing a lot more about that. Okay, 600 pounds every month at Radio City Music Hall. What is it? It's chewing gum scraped from under the seats. Isn't that pleasant, huh? Wouldn't you love to be working there? All right, that's my 5-minute morning show. We'll see you next time.